Prior to having hip replacement surgery, we first need to talk about all the potential risks of the surgery. All of these risks are relatively low. They hover around 1 or 2%, and hip replacement surgery in general is very successful. The first risk factor that I want to talk about is infection. Factors that make you at an increased risk for infection are things like obesity, diabetes, smoking, previous infection, low vitamin D, and there's several others, including kidney failure. We do everything we can to minimize those risks prior to surgery to avoid infection. The next one is bleeding. Bleeding with modern anesthetics is relatively low, and transfusion is extremely rare nowadays. Nerve damage after surgery can result, but typically any significant nerve damage resulting in numbness, weakness, and tingling are pretty rare. However, just on the outside of the incision after the direct anterior hip approach, people do typically have some numbness there. You can also have cold shocks, tingling, things like that. Generally, any symptoms of nerve damage resolve over time within a year. However, most people are left with a little bit of numbness on the outside of the incision there. The next one would be leg length differences. This can happen. Typically, it's very minimal and not noticeable. There's a risk of dislocation. This is higher in people who have lumbar spine disease, but it's lower in the direct anterior approach. There's a chance that you can wear out the plastic bearing. There's a chance that the prosthesis can loosen and need to be revised. There's a chance that you can have continued pain afterwards, and we'd have to look elsewhere to see why you're having pain after a hip replacement. There's a risk of pulmonary embolism and blood clots. These are relatively low unless you've had a history of that before. There's also a risk of fracture both during the surgery as well as after the surgery. You can fracture around the stem or the cup component.